Hey everyone, so today I want to talk about mental health first aid. First of all, don't go up to someone and say, hey, do you have a mental health issue? Now, some of you might be thinking, why are you telling me that? Of course I wouldn't do that, that is not tactful. But some of you might also be thinking, well, why wouldn't I do that? Because we want to break the stigma, so why can't I just go up to someone and say, hey, do you have a mental health issue? Like, you'd go up to someone and say, hey, do you have a cold? Or something like that. Fair enough on both sides. The issue here is that it is a personal issue, it's a personal health issue, and even if there wasn't any stigma around, people might just not want to talk about a personal issue like that. And the fact is, there is still stigma around, so it's even more important that you don't just go up to someone and put them on the spot like that and say, hey, do you have a mental health issue? Or hey, are you feeling like stressed out? Or anything like that. Just be more tactful with them. It's better if you have a close relationship with them, so maybe you do feel like it, within your personal relationship with that person, it is okay for you to say that. But on the whole, if it's just a colleague you barely talk to, please don't just go up to them and put them on the spot like that. What you can do though is do mental health first aid, which is basically look, listen and link. Just glancing at my notes from the World Health Organization. They've put this on their website as well as psychological first aid action principles. So what do we mean by that? Okay, so the first thing is look, check. As you would with physical first aid issues, you check the scenario to check if there's a loose electrical wire somewhere, or there's basically something around there which you think is that's what's caused the physical injury of the person you're trying to help. You'd look around and check to see that's not going to hit you too. So in the mental health scenario, you check for safety. Check that the environment around isn't a volatile environment. Like if you've perhaps identified someone who's being bullied in the playground, take them out of that scenario, because if you keep them in that scenario with the bully still there, that's just going to make the situation even worse. They're still in the danger zone. So the second thing is to check for people with obvious, urgent, basic needs. So there's that parallel again with physical first aid in that you treat the person who's hemorrhaging massively first before the person who may just have like a scratch on their arm. That's kind of just made it more obvious there, but to make more extreme examples, but just to make it more clear there. So treat this person who has more extreme symptoms before the person who maybe doesn't have so many extreme symptoms. That is harder with mental health in that it's not always easy to tell, but the way you can investigate that further is to talk to the people and also check for distress reactions. So if someone is head in their hands, possibly even hyperventilating, they probably have a higher priority than someone else who's just sort of sat there. They might be sitting there looking completely numb and not really moving much, but at least they're sitting upright and they're breathing properly. They're breathing normally. Whereas someone who's hyperventilating, obviously that's having a physical issue as well to their health. So that's look, check for safety, check for people with obvious, urgent distress needs and someone with serious distress reactions. The next one of look, listen, link is listen. So approach people who may need support. Just the main thing is with whenever you have a mental health issue, I think, is to just find someone who will just hear you out and you think will actually believe you and cares about you enough to listen to all the stuff you have going on in your life. So just be a kind person, lend an ear and listen to what they have to say. Try and help them to feel calm. Don't just say, hey, calm down. That's not going to work. But mainly just listen to them, show empathy and like nod and say, yeah, that sounds horrible. But mostly just try and sound genuine. Just be genuine, speak from the heart. And the third one is link. So once that you've identified that this person has a problem and you've listened to their problems, then it's about getting them the help they need. Now, in a lot of circumstances, it might not be that you are the best person to help. Sometimes you can be, because we've all gone through hard times and depending on your skill set, you might be able to give them a nice heart-to-heart and make them feel better if it's something that's not something that needs specialist help. But sometimes they might need specialist help or absolutely just send them to the right person. But do it in a way where it's not that you're sort of fobbing them off. or that you just don't have time for them or anything like that. Just be honest and say, oh, okay, I've heard what you said. I really want to help you. I don't think I'm the best person to help you, but I do want to introduce you to this other resource. For instance, Ella Friends or Samaritans, your GP. I'll go into that in more detail in another video of other resources available, and then catch up with them as well if you can, if it's appropriate, and see how they're doing as well. So you show that you do care and you're giving them afterthought as well. So making sure that they do find the help they need, even if you're not the one who's able to give them that help. So to summarise, look, listen and link. So look for who needs help, listen to them, and then link them to the help they need. Hope you found this useful. For more tips and advice on how to live mentally healthy and manage your mental health for success, do subscribe to Me and My Mental Health on my Facebook page, or just keep in touch on this, whatever medium you're listening to or watching this on right now. Thanks. Bye.